How did polio and/or shape physical therapy's history? Imagine a time when a mysterious illness swept across communities, leaving many children and adults paralyzed and unable to move freely. This was the reality during the early 20th century when poliomyelitis, commonly known as polio, caused widespread fear and disability. At the same time, global conflicts such as World War I and World War II created a surge in injuries and physical disabilities among soldiers and civilians alike. These two monumental events significantly influenced the development and evolution of physical therapy as a specialized healthcare field. Polio outbreaks in the early 1900s prompted the need for innovative approaches to restore mobility and function in affected individuals. Medical professionals and early physical therapists began to develop techniques focused on muscle strengthening, joint mobilization, and respiratory therapy to combat the paralysis caused by the virus. During this period, the use of braces, crutches, and early forms of exercise therapy became more prevalent as ways to help patients regain independence. The establishment of dedicated rehabilitation centers was driven by the necessity to treat large numbers of polio survivors, leading to the formalization of physical therapy practices. World War I and World War II further accelerated advancements in physical therapy. The wars resulted in a vast number of injured soldiers requiring rehabilitation to return to active duty or civilian life. Military hospitals became centers for developing innovative treatment methods, including massage, electrotherapy, and therapeutic exercises. The need to efficiently treat large populations of injured personnel led to the creation of standardized protocols and training programs for physical therapists. These efforts helped transform physical therapy from a collection of isolated techniques into a recognized healthcare profession with structured education and professional standards. Additionally, the wars highlighted the importance of multidisciplinary approaches to rehabilitation, integrating physical therapy with other medical disciplines. The experiences gained during wartime injuries and polio recovery contributed to the understanding of musculoskeletal and neurological rehabilitation, laying the groundwork for modern practices. The focus on restoring function and mobility for both war veterans and polio survivors ultimately expanded the scope and credibility of physical therapy as an essential component of healthcare. In summary, the challenges posed by poliomyelitis outbreaks and the injuries sustained during global conflicts spurred significant innovations and growth within the field of physical therapy. These historical events underscored the importance of rehabilitation and helped establish physical therapy as a vital healthcare profession dedicated to improving quality of life for those with disabilities.